Have you ever felt persistently sad, lost interest in activities you once enjoyed, or struggled to find the energy to get through the day? These experiences may be more than just passing moods. They could be symptoms of depression. Depression, a complex mental health condition, affects millions of people worldwide and can significantly impact daily life and well being. Let's explore 10 common medications that can cause depression. Depression manifests in various symptoms, including persistent sadness, loss of interest or pleasure in activities once enjoyed, changes in appetite or weight, sleep disturbances, fatigue or loss of energy, feeling of worthlessness or guilt, difficulty concentrating or making decisions. If you're experiencing symptoms of depression or other mood changes while taking these medications, don't hesitate to reach out to your healthcare provider for support and guidance. Number 1. Corticosteroids. Corticosteroids are widely used to treat inflammation in autoimmune conditions such as rheumatoid arthritis and asthma. However, they may also lead to mood disturbances, including depression. The reason lies in their ability to disrupt the balance of neurotransmitters in the brain. Normal adult dosages vary depending on the condition being treated, ranging from low to high doses. It's crucial to follow the prescribed regimen carefully and gradually taper off the medication under medical supervision to minimize the risk of adverse effects. Common side effects include weight gain, insomnia, and mood changes. Number 2. Beta blockers. Beta blockers are commonly prescribed for conditions like hypertension, angina, and migraines. These medications work by blocking the effects of adrenaline, thereby reducing heart rate and blood pressure. While effective in managing cardiovascular conditions, beta blockers can also affect mood and lead to depression symptoms in some individuals. Adult dosages are determined based on the specific indication and the patient's response to treatment. It's important to use beta blockers as directed by a healthcare professional and report any changes in mood or behavior promptly. Possible side effects include fatigue, dizziness, and sexual dysfunction. Number 3. Hormonal contraceptives. Hormonal contraceptives, including birth control pills, patches, and injections, are widely used by women to prevent pregnancy. While generally safe and effective, hormonal contraceptives may contribute to mood changes and, in some cases, depression. The hormonal fluctuations caused by these medications can impact neurotransmitter activity in the brain, potentially leading to mood disturbances. Dosages vary depending on the type of contraceptive and individual factors such as age and medical history. It's essential to discuss any concerns about mood changes with a healthcare provider when using hormonal contraceptives. Common side effects may include nausea, breast tenderness, and changes in libido. Number 4. Anticonvulsants. Anticonvulsant medications are primarily used to manage epilepsy but are also prescribed for other conditions such as bipolar disorder and neuropathic pain. While effective in controlling seizures and stabilizing mood, some anticonvulsants may increase the risk of depression as a side effect. The mechanism underlying this association is not fully understood but may involve alterations in neurotransmitter function. Dosages of anticonvulsants are tailored to the individual's needs and may require adjustment over time. It's crucial to take anticonvulsants regularly as prescribed and attend regular follow-up appointments to monitor for any adverse effects. Possible side effects include drowsiness, dizziness, and gastrointestinal disturbances. Number 5. Statins. Statins are a class of medications used to lower cholesterol levels and reduce the risk of cardiovascular disease. While generally well tolerated, some individuals may experience mood changes, including depression, while taking statins. The exact mechanism by which statins may affect mood is not fully understood but may involve alterations in the production of neurotransmitters such as serotonin. Dosages of statins vary depending on the specific medication and the patient's cholesterol levels. It's important to adhere to the prescribed dosage and attend regular checkups to monitor for any adverse effects. Common side effects of statins include muscle pain, liver enzyme abnormalities, and gastrointestinal symptoms. Number 6. Benzodiazepines. Benzodiazepines are a class of medications commonly prescribed for anxiety, insomnia, and certain seizure disorders. While effective in managing acute symptoms, long-term use of benzodiazepines may lead to tolerance, dependence, and withdrawal symptoms, including depression. These medications work by enhancing the activity of gamma-aminobutyric acid or GABA, a neurotransmitter that inhibits brain activity. Dosages of benzodiazepines vary depending on the specific medication and the severity of symptoms. It's important to use benzodiazepines for the shortest duration possible and under the guidance of a healthcare professional. Possible side effects include drowsiness, confusion, and impaired coordination. We made a buck! 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 7. Proton pump inhibitors or PPIs. Proton pump inhibitors or PPIs are commonly used to treat conditions such as gastroesophageal reflux disease or GERD and peptic ulcers by reducing the production of stomach acid. While generally well tolerated, long-term use of PPIs have been associated with an increased risk of depression. The exact mechanism underlying this association is not fully understood but may involve alterations in the absorption of certain nutrients and changes in gut microbiota. Dosages of PPIs vary depending on the specific medication and the severity of symptoms. It's important to use PPIs as directed by a healthcare professional and discuss any concerns about mood changes promptly. Common side effects include headache, nausea, and diarrhea. Number 8. Opioids. Opioid medications are powerful pain relievers prescribed for acute and chronic pain conditions. While effective in managing pain, opioids carry a risk of dependence, addiction, and mood disturbances, including depression. These medications work by binding to opioid receptors in the brain and spinal cord, altering the perception of pain and mood. Dosages of opioids are carefully titrated based on the severity of pain and the individual's response to treatment. It's crucial to use opioids as directed by a healthcare professional and to be aware of the potential for misuse and adverse effects. Common side effects include constipation, sedation, and respiratory depression. Number 9. Antihypertensive medications. Antihypertensive medications, including diuretics, ACE inhibitors, and calcium channel blockers, are used to lower blood pressure and reduce the risk of cardiovascular events. While essential for managing hypertension, some antihypertensive medications may contribute to depression as a side effect. The mechanisms underlying this association vary depending on the specific medication but may involve changes in neurotransmitter activity and hormonal regulation. Dosages of the antihypertensive medications are tailored to the individual's blood pressure readings and may require adjustment over time. It's important to follow the prescribed regimen closely and report any changes in mood or behavior to a healthcare professional. Common side effects include dizziness, fatigue, and electrolyte imbalances. Number 10. Isotretinoin. Isotretinoin, commonly known by the brand name Accutane, is a potent medication used to treat severe acne that has not responded to other treatments. While highly effective in clearing acne, isotretinoin carries a risk of psychiatric side effects, including depression and suicidal ideation. The exact mechanism underlying these effects is not fully understood but may involve alterations in neurotransmitter function and inflammatory pathways. Dosages of isotretinoin are based on the individual's weight and the severity of acne. It's crucial to use isotretinoin under close medical supervision and to be vigilant for any signs of mood changes or suicidal thoughts. Common side effects include dry skin, chapped lips, and muscle aches. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!